So, Eric, we've talked about how easy this is to use and the data points that it brings and how much better it makes the doctor's ability to be able to diagnose things early and treat them early so that they're not irreversible. So I hear all this and I'm thinking, wow, that's wonderful. That's wonderful. But how much is it going to cost me? Like, is this, talk about that. Like, so is this a big cost to the patient, to the doctor, to the, like, what is that?
Great question. That's usually the greatest killer of innovation in healthcare is we can't figure out how to pay for it. And the worst thing that can ever happen is getting branded as a golden scalpel, something that's clearly better, but not better enough to get paid more. So here's the issue. How do you get people to do this more? Generally, the tech guys will tell you, oh, put everyone on a subscription. People will buy it. People will do this. And the simple answer in healthcare is no, they won't, especially people, over 65 who've put into the system over time. They now have Medicare. They have a Part B coverage. They have these private insurances. They don't view healthcare as free, but they're certainly not going to pay for it themselves if they think it's owed to them. And that's the way the system's built. So the second most important component of keeping the doctor involved is being able to operate within the system as it's built. So finding a way to get coverage. And we're very proud of the fact that we were able to do that. And so there's no acquisition cost to the physician because this is an app. This is a SaaS model. So he doesn't have to pay anything up front. The patient pays nothing other than what may be required by their insurance when they do tests. And for us, we've built out this model that allows us to work with the doctor so that they pay a very small component of what they make. So for us, it worked out really well. The physician is not going to be out of pocket in the beginning. We have them pay for that privilege of using the system and getting more data, but financially it makes better sense to them. And there's nothing up front. There's no yearly service fees. So financially, we've made it very easy for doctors to adapt to this in their practice.
So there's no big like $50,000 to $100,000 cost for this new equipment, having to pay for a person to staff the equipment, having to have, what could be, a room to see patients in. None of that is needed. They have a low cost for your product, no very low entry. They still make some money on it. So this is still something that's good and it gives better care to the patients and it's not really going to cost the patients anything more than what any other kind of treatment would.
Exactly.
Okay.